Good afternoon, everyone, and welcome. My name is Diego Ortiz. I'm the Communications Director for the American Heart Association, and it's my pleasure to wish you a happy World Heart Day. You might be thinking, I've heard of Heart Month in February, but what is World Heart Day? Well, we hope that today is the day when people around the world make a commitment to their heart health by doing just one thing that makes their heart happy. So go for a walk, get up and dance, sign up for that yoga class that you've been putting off. It only takes one step, one healthy lifestyle choice to get closer to a healthier heart. And today's webinar is also special because it kicks off the 2021-2022 Go Red for Women movement in Westchester. And this year, Go Red will continue to innovate by engaging, educating, and empowering women in our community through programs and activities designed to raise awareness, provide tools for women and their families to take charge of their health, and remove barriers to care. And of course, we want to take this moment to thank our national Go Red for Women sponsor, CVS Health, and our Live Fierce Go Red sponsor, White Plains Hospital. Before we get started, if you have questions for the panelists, please type them in the chat box. All right, now let's introduce the panelists. First, Dr. Shalini Bobra. She's a cardiologist from White Plains Hospital Physicians Associates. We also have Dr. Patrick Thomas, a cardiologist and member of both the Eastern States Regional Board and the Westchester Board of the American Heart Association. And our moderator today is Jennifer Bello, the 2021-2022 Westchester Go Red for Women co-chair and Senior Director of Nursing at White Plains Hospital. And before I hand it off to Jennifer, I want to encourage you to support Go Red for Women to improve women's health by making a donation. It's as easy as texting Go Red 914 to 4144. That's Go Red 914 to 4144. All right, and now without further ado, I want to welcome in our panelists. Take it away, Jennifer.
Thanks, Diego, and thank you to everyone who's participating today. This is an important first step when we learn to come together to learn about our risk factors as women and look to make the first step to changing life habits. Dr. Thomas, historically, women's #1 health threat is cardiovascular disease. How has the risk of heart disease and stroke changed over the past 18 months?
Great question, Jennifer. Thank you so much. And certainly want to give a warm welcome to everybody joining us this afternoon for a short and hopefully very educational session. Unfortunately, for many, many decades, heart disease and stroke have killed more women than any other cause of death, and that has not changed over the last 18 months of the coronavirus pandemic. In fact, last year, about 430,000 women died of cardiovascular disease, again, heart attacks and strokes. To put that in perspective, that's more than all forms of cancer and all forms of lung disease combined. We do know that COVID-19 can affect the heart, both directly as well as the inflammatory response that the body makes to the COVID virus. And so that actually increases heart risk. But unfortunately, a lot of things that occurred during the pandemic led to worsened control of risk factors. People didn't get out and exercise as much. Diets fell by the wayside, and alcohol consumption skyrocketed over the last 18 months. And all of these can lead to worse cardiac outcomes. So heart disease is and will remain the #1 killer of women for many, many years to come, unfortunately.
Thanks, Dr. Thomas. And when we think about all of these risk factors, Dr. Bobra, with the increased risk that makes it all more important for us to know warning signs, can you share with us what we should be looking for as women as potential risk factors and warning signs?
Yes, good afternoon, everybody. Happy World Heart Day. I do agree with you, Dr. Thomas, with all the points you made. I also wanted to add that a lot of people were worried to see their doctor during the pandemic. And we had a lot of missed appointments. People didn't go for their checkups. A lot of times they were scared to go into the emergency room because they were worried they would catch COVID. So I do want to give a plug to please get vaccinated if you don't have your vaccine already, because that's probably the most important thing you can do for your health at this time. But getting back to the risk factors, I think all of us here would agree that men and women are very different. I know my husband would agree with that statement. We're different in many ways, but the most common symptom for a heart attack for all of us is actually chest pain. A huge study was conducted in people under the age of 55, and they asked them, what were your symptoms, before you had your heart attack? And 90% of people actually reported chest pain. The only difference was that in addition to chest pain, women often described additional symptoms. So when we're talking about chest pain, a lot of times we think of that Hollywood type of heart attack where it's in the center of the chest or the left side and goes down your left arm in a sort of a crushing fashion, but it doesn't have to be that dramatic. A lot of times we see people who come in with chest tightness, a little bit of a squeezing sensation. A lot of women actually describe indigestion symptoms. And they say, I think maybe I ate something different last night. It can be vague at times. So that's something that I do like to mention. In addition, another common symptom is feeling short of breath. So even after minimal exertion, like just walking a few feet, if you feel tired, if you don't quite have your energy level there, that's something to be aware of. A lot of women describe feeling dizzy or faint, a sort of lightheadedness they've never experienced before. So that's important to note. Or just generally being tired. We're used to doing so many things as women, taking care of everybody, taking care of work obligations, perhaps, taking care of the house obligations, perhaps. And so you think that being tired is just, an everyday thing, but I tell patients that your body is the best. So if there's something that's not quite right, think about your heart first.
Thanks, Dr. Bobra. That's so important too, because I think, as being a woman myself, a lot of times we look at our symptoms as just every day feeling tired or fatigued, and sometimes it can be really important risk factors that we're not paying attention to. So it's very important to hear that coming from you, how important it is for us to really pay attention to those symptoms. And they're all, really great tips. In terms of another particular focus that we would like to look at is maternal health for a moment. And the U.S. leads the developed world in maternal death and cardiovascular disease. What is that, and what can we do to help change that?
Sure. So I think in addition to traditional risk factors that we tend to ask people, a new area that we've become more interested in is maternal health. So there are certain risk factors that only pertain to women because, as far as I know, only women can get pregnant. So it's very important to note pregnancy history. So if, for example, women have had high blood pressure during their pregnancy in many forms, including preeclampsia or eclampsia, if they had elevated sugars during their pregnancy, that's important to know. Interestingly, preterm delivery is also a risk factor for heart disease, particularly if you've given birth to a baby before 34 weeks. That can place you at higher risk of future heart disease, which is something that we're learning about, which is pretty recent. I also like to ask about infertility treatments because a lot of women nowadays have used these great therapies, but some of these treatments can actually predispose to having high blood pressure or hypertension. So that's important to know. We also ask about birth control, particularly in women who smoke, because that can put them at a higher risk of having blood clots. So all of these are very important, as well as menopause, of course. Risk tends to go up as we all get older. So a menopausal history, whether it's premature menopause due to a surgery perhaps, hysterectomy, or natural menopause, that's important to know. And then there are also, Jennifer, what we call female predominant conditions. So these are conditions that happen in men and women, but just more often in women. For example, some of the autoimmune disorders like lupus and rheumatoid arthritis. These sort of inflammatory conditions can predispose someone to a higher risk of a heart attack and stroke as well.
If I could just amplify, I think all those are fantastic points with regard to maternal health in particular, but I do want to just, for everybody that's joining us this afternoon, to reiterate the other just traditional risk factors, whether it's smoking, high blood pressure, high cholesterol, diabetes. These are very important modifiable risk factors, something we can do something about. And of course, genetic history. If you have people in your family who had heart attacks at young ages, unfortunately, we don't have a lot we can do in terms of changing somebody's genetic history, but at least we can focus on those risk factors that I mentioned earlier, whether it's blood pressure, cholesterol, diabetes, and smoking, to try to reduce risk over time.
And even these risk factors that you mentioned, Dr. Thomas, some of them have a higher impact in women. So for example, a woman who smokes will have greater vascular effects for the same amount of cigarettes smoked compared to a man. And having diabetes is more prevalent in women, and the effect of diabetes imparts a greater risk to women. So learning about these traditional risk factors are very important, I agree.
And just sparking from the conversation, one of our attendees had a question specific to blood pressure, that it moderately runs high in the morning, even though they're taking their blood pressure medication at night. So just wanted to get some thoughts or feedback related to that concern, because that's good. We're paying attention to our blood pressure readings and taking our medication as needed. So just wanted to gain some insight as to feedback from one of our participants.
Sure. I mean, I think firstly, gold star for checking your blood pressure, because that's usually the first thing that we suggest. I would also say, if you have time, check it more than once a day if you can, to see what the trend is. And you're saying that it's higher in the morning. That's important to know. Sometimes we would change then the timing of the blood pressure medicine you would take. That may help. Or so other times you may need an adjustment, but it is natural to have higher blood pressure in the morning due to adrenaline and other hormonal effects. So, that's a great question. Good.
And I guess another question directed towards both of Dr. Thomas and Dr. Bobra. It's vital that we know the signs and symptoms, but really the goal is prevention, so that these cardiac events that could really lead to catastrophic disabilities don't occur in the first place. And women tend to face a lot of unique challenges in prioritizing their own health. We serve in many different roles, mothers, career, and usually we're at the bottom of the list, right? Even when we talk about those vague symptoms you mentioned in the beginning, we sometimes, push them off to the side. So what tips would you guys have for women to kind of really help to look to prioritize their health and how important their heart is?
So I can start, and Dr. Bobra can certainly share her thoughts as well. I think prevention is what Dr. Bobra and myself, we really focus on. Neither one of us wants to be in an emergency room trying to save somebody's life when they've had a heart attack or stroke. We want to prevent that from happening in the first place. And the American Heart Association estimates 80% of all cardiovascular disease can be prevented through a combination of lifestyle and appropriate medications where necessary. When it comes to lifestyle, I'll just start by simply saying move and move more, right? Simple, easy exercise. I'm not talking about training for the marathon. I'm not talking about going and doing an Ironman triathlon. I'm simply saying get out, go for a half-hour walk, right? The American Heart Association recommends 150 minutes of exercise, 2.5 hours in the course of a week. So that's a 30-minute session, 5 days a week. No, you can't do all 2.5 hours on a Saturday. You have to break it up into nice little chunks. That is one of the most powerful forms of prevention that we have, is just simply getting out and moving. Any exercise is better than no exercise. And yes, we can talk about intensity, we can talk about different types of exercises, but just get out and move. Nothing is more powerful than that. So I'll stop there and let Dr. Bobra chime in.
Yeah, that's excellent point, Dr. Thomas. You don't need to join a fancy gym. You don't need to learn. I had a patient the other day who wanted to do some acrobatic thing. I said, I think that's a little complicated. You could just go walk, So I agree with that. I think another important tip, and I feel like this is one of the most popular questions that patients ask me, is what should I eat? So I think if you eat smart, I am recommending now to all patients to try to adopt a plant-based diet. We have now study after study showing that if you eat more fruits, vegetables, plant-based protein, nuts, olive oil, you will live longer. There's no doubt about it. A large trial just came out that showed that if you adopt this sort of diet at least 5 days a week, you actually reduce your chance of having a heart attack and stroke by 30%. There is no drug out there that can do that for you. And I also like this because you have control. You know what you're eating, you know your grocery list, your portion size, your recipes. This is all in your control. So I would say try at least a couple of times a week to go plant-based and move up from there.
Just to amplify on that, so the American Heart Association does statistical analysis every year about how well people are doing with diet and exercise. And so the statistics from 2018, which are pre-pandemic, are actually appalling in terms of how poorly we're doing as a society. So for adults over the age of 20, fewer than 25%, less than a quarter, are getting that 30 minutes, 5 days a week of exercise. But the healthy diet's even worse. 0.3% of all US adults are eating what the American Heart Association considers a healthy diet, less than 1%.
Wow.
Wow.
Just to add to that also, oh, sorry, Jennifer.
Go ahead.
In addition to that, you do want to avoid processed foods that are just loaded with salt and sugar. So
it's not that hard to eat healthy these days. The old mantra was, if it tastes good, don't eat it. Well, that you don't have to do that anymore. You don't have to do that anymore. If you go to the American Heart Association website, heart.org, or goredforwomen.org, and you click on the healthy living button, all sorts of diets, recipes, healthy eating tips pop right up. Simple, easy. And nowadays, all of these types of foods are available in our local supermarkets. And it is really not a challenge to have a mostly or completely plant-based diet and do it well and enjoy your food.
I think it's important related to the plant-based diet. You said 5 days a week. So if we really want to just ease our way into it, that gives you the weekends to cheat a little bit here or there as you're starting to get used to your routine. So I think that that's an important takeaway too, right? We're not asking everyone to change their diet fully 7 days a week, but to kind of slowly integrate it. And you're right, food is so much easier these days to get good tasting, healthy food that is easy to purchase. So all good comments related to that. Just in terms of where we're at, what would you say would be really the number one most important thing for everyone who's listening today to really start doing?
There are so many, Jennifer, but I think the top, can I give you the top two? I would say that the number one should be stop smoking. I don't know how many people are with us today who smoke, but that is the most preventable cause of death. And I do mean cigarettes, e-cigarettes, vaping, the whole gamut. Just that would be number one. And I know it's easy for me to say, it's highly addictive. So please reach out to your family, your friends, your doctor to get help with that. That will give you a huge heart healthy benefit. My second one, I'm just going to throw this in here, is that you should know your numbers. So the traditional risk factors that Dr. Thomas mentioned, a lot of these risk factors are silent. So the only way you would know that you have diabetes or high sugars really is to get a blood test. So I would say you need to kind of know what your numbers are there, your weight, your blood pressure, your cholesterol. And then once you know those numbers, your physician can guide you with a care plan just for you on how to modify your risk. So those are my two tips.
I can't disagree with either one of those. Stop smoking is number 1 through number 10 on the top 10 list, as far as I'm concerned. And, unfortunately, we thought vaping might be a nice way to transition off of smoking. No vaping, no traditional cigarettes, nothing. I will just, I'd say, aside from what Dr. Bobra mentioned, my one thing to do for everybody listening in today is go to the Go Red for Women website and just tool around a little bit and look at and explore. There is so much information there, and particularly sign up for one of the American Heart Association's 30-day healthy behavior journeys. If you put in your email address on that Go Red for Women website, they will send you a daily update, whether it's about moving more, whether it's about eating smart, managing blood pressure. Those are the different journeys you can follow. It really gives you a fantastic opportunity to learn some things, reinforce some stuff you may already know, and really get you off on the right foot in terms of trying to change some behaviors and adopt a healthier lifestyle.
Great advice, and definitely small things that we can start doing today. One of the participants, Haley, was interested to get your thoughts on intermittent fasting and how that can be incorporated, or if there's any benefits to doing that type of eating.
Go ahead, Dr. Thomas.
So I have a very, very strong opinion about this, and intermittent fasting is a great way to wreck your body. I'm a former Division I wrestler. I know a lot about weight management, unfortunately, from doing it wrong for many years. And starving your heart for 16 hours a day, or whatever people do for intermittent fasting, there's no clinical evidence in large, well-controlled trials showing that this has benefit. In fact, most dietitians, most nutritionists will tell you you probably need to eat 5 or more times a day in very small amounts to keep feeding the engine. Your heart is like a car engine. If you choke off the fuel supply for 16 hours, it's not going to like that very much.
Thanks. And it seems like our participants are taking to heart the no smoking advice. The question did come through related to smoking cannabis. And is this a risk?
I think we're getting the data on that, and it is a risk. Yeah, it is a risk. So I would say smoking of all types, just avoid altogether for better heart health. Jennifer, I did want to mention one other thing that I wanted to touch upon is to really monitor your mental health. Dr. Thomas mentioned that in the beginning how devastating the pandemic has been, and alcoholism is really skyrocketed, like he said, but with that, depression rates have really gone up. And we know that there's a strong connection between the mind and the heart. And studies have shown that women under the age of 55 with moderate to severe depression actually have more than 2 times the chance of developing heart problems. So if you think that this may be an issue for you, I do encourage you to reach out and get some help.
Thank you. That's really an important point. And even more important in terms of us getting out and getting moving, right? Getting out, seeing fresh air, engaging in activities, all of those can help us too with our mental health. There was another question that came through related to your thoughts on heart healthy supplements such as fish oils and CQ10.
Everybody would like to find a magic pill that makes things better. Most supplements have not been studied adequately. And so there's a buyer beware aspect to most supplements you find over the counter. Coenzyme Q10 has actually been studied quite exhaustively in the cardiovascular space, and actually fish oil has too. And unfortunately, neither over-the-counter fish oil nor coenzyme Q10 has ever been shown to have any benefits with regard to heart outcomes that are beneficial. So I generally advise people to save their money and not spend it on coenzyme Q10 or over-the-counter fish oil. If you want fish oil, eat salmon, eat swordfish, eat tuna, eat something that's going to give you fish oil. Don't just take a pill.
Excellent advice. Another question came through in terms of the #1 cause of heart attack outside of smoking, diet, or genetics. What would you guys say?
I think diabetes is a big one. If you want the top cause. And what's interesting about diabetes is that I don't know the exact number, maybe Dr. Thomas, but there are a lot of people out there who have diabetes and they don't know that they actually have diabetes. So, getting heart healthy is sort of compounding interest. The sooner you know your numbers, the sooner you adopt a healthier lifestyle, the better off you're going to be. So I would say, again, just get a basic checkup and start from there.
Just amplifying on that, there's no question for me that diabetes is that #1. And just to put it in perspective, 86% of diabetics die of heart attacks and strokes. They don't die from the diabetes itself. They die from the blocked up arteries that diabetes contributes to.
Thank you. And I think it's so important, as really the purpose today of World Heart Day is to look at proactive preventative strategies, right? So we can avoid those catastrophic events that we potentially don't understand the disabilities that can come from heart attack or strokes. We have about 2 minutes left. In terms of one of the last 2 questions that we have is related to coffee and caffeine, and how caffeine can be related to some risk factors for heart disease.
Certainly caffeine and coffee consumption has been studied on and off for decades. There have been all sorts of studies initially showing some benefits, some harm. When you look at everything kind of mixed together, it's like your mom always said, everything in moderation, right? And so if you're having a cup or 2, and we're talking an 8-ounce cup, not a 32-ounce cup of coffee daily, that almost certainly provides no harm and might have a little bit of benefit, as long as you're not dumping cream in it and a lot of sugar. So definitely, a little bit of coffee is okay. If you're having a pot of coffee a day, yeah, not a good idea.
Excellent. And I think one last question that we have, which goes along with really our theme today, is during their annual physical, what specific tests and what age should EKGs and blood works be performed?
Sure. So I would say starting at age 20, EKG should be done. And blood work, along with the routine blood work, certainly a fasting lipid profile, which would check your cholesterol, a fasting glucose, which would give us an idea of diabetes. One step up from that is something called a hemoglobin A1C that may be ordered. along with urine analysis and your electrolytes, and also vitamin D level. That would be a good start.
Excellent. Well, Dr. Bobra and Dr. Thomas, I want to thank you so much for your time today. We're all out of time, and I'm sure that we've got a lot of tips to take away from us as we look to be preventative in our heart health on World Heart Day. And thank you again for taking time out of your day.
Thank you.
Thank you.
And on behalf of the American Heart Association, we want to thank all of you for joining us today. We also want to encourage you to please visit our website, goredforwomen.org. We can share that link one more time in the chat box. And we encourage you to start your own journey to better health. And we want to thank our panelists, Dr. Shalini Bobra, Dr. Patrick Thomas, and our moderator, the chair of the 2020-2022 Westchester Go Red for Women movement, and senior director of nursing at White Plains Hospital, Jennifer Bello. And we also want to encourage you one more time, if you've been inspired by today's program and want to support Go Red for Women's mission to improve women's health and save lives, you can do so right now by texting Go Red 914 to 41444. That's Go Red 914 to 41444. Finally, happy World Heart Day. Remember, today is the perfect day to take one step and do one thing for your heart. Take care, everyone. Take care of your hearts and be well.